Hi, I'm Dr. Lisa Roth from the lymphoma program at Weill Cornell and New York Presbyterian. I want to welcome you today to our review of emerging data for lymphoma patients, or REDLAMP program, where we review recent publications that have information that might be of interest to our patients who are dealing with lymphoma. So today I'll be reviewing a publication that was recently in the journal Lancet Oncology, and the title of this publication is Parenthood in Adult Female Survivors Treated for Hodgkin Lymphoma During Childhood and Adolescence, a Prospective Longitudinal Study. So this study was conducted by Dr. Bramswig and colleagues from the Children's University Hospital in Munster, Germany. And the purpose of this study was to answer an important question specifically for women who have been treated for Hodgkin lymphoma as children. Specifically, how does the treatment for Hodgkin lymphoma affect one's ability to have children later in life? So this is an important question because we know that the treatments that we use for Hodgkin lymphoma can affect ovarian function and ultimately can affect fertility. So there's two broad categories of treatments that we use for Hodgkin's that can affect one's fertility. First are chemotherapy agents. So there are specific drugs, namely called procarbazine and cyclophosphamide, which we know can affect ovarian function. And then also radiation. So there are a portion of patients who require radiation as part of their treatment for their Hodgkin's, and if the radiation is in a specific field, particularly if the ovaries are exposed to radiation, we know that that can affect ovarian function. So the authors of this study looked at a group of people who had been treated for Hodgkin lymphoma when they were children and followed them later on in life, and specifically for the women, collected information on whether or not they ultimately conceived children. And they took that group of patients and compared it to the general population in Germany, matched for about the same age, to compare the likelihood of becoming a parent if you had been treated for Hodgkin lymphoma versus the general population. So what did they find on this study? Well, first of all, they had a pretty large group of patients. They had about 467 women who had been treated for Hodgkin's when they were children, and they followed them for at least 5 years after their treatment, and many of them for much longer than that. And they found that the cumulative incidence, or the likelihood of becoming a parent by the age of 40, was 69% among those who were treated for Hodgkin's, and that was about the same as the general population for Germany. So there's kind of two important take-home points from this study. One is that broadly looking at this group, the likelihood of becoming a parent, whether you were treated for Hodgkin's or not, was about the same. And then secondly, they looked at the health of these children. So they looked at the rates of congenital malformations and birth defects, and they also found no difference. So no difference if you had been treated for Hodgkin lymphoma or if you were part of the general population that they had looked at in this trial. Now, when they looked more closely, there were two specific groups that had a lower likelihood of becoming parents among the Hodgkin lymphoma survivors. And those two groups were women who were age 40 and above, and women who had received radiation to the area in the pelvis. So the radiation is not surprising, specifically if the radiation involves ovaries. We know that that can affect fertility. As for the older age, the reason for those patients being less likely to become parents, it's not entirely clear. It might be that treatment affects one's ability to have a child later on in life when we know fertility declines in all women, or it might be that they had been treated on earlier protocols where they had received higher doses of chemotherapy. So what does this mean for patients with Hodgkin lymphoma today? Well, there's two important take-home points. I think for those people who have been treated for Hodgkin lymphoma, this study is very reassuring that the likelihood of going on to conceive a healthy child is quite high. And for those people who have been recently diagnosed with Hodgkin lymphoma, I think it just brings to light an important issue of fertility, and it's important to speak to your physician about the type of treatment that is being planned for your Hodgkin lymphoma and what fertility preservation options might be available to you prior to starting that treatment. So I hope this review was helpful for you, and I thank you for joining me today.